So, good evening, everyone, and welcome to the 2038th uninterrupted webinar series of the International Forum for Promoting Homeopathy. And my name is Arya, and I'll be your moderator today. I'm a third-year student from ANS's Homeopathic Medical College, Kottayam. So today, our guest is Dr. Kulwant Singh. He is the principal of Singhbum Homeopathic Medical College, Jamshedpur, and a former member of Educational Committee, CCH. So today, Dr. Singh will be discussing with us a rather significant condition that Indians are facing today, which is peptic ulcers. So we all know that there are so many reasons for this peptic ulcer to happen, like Helicobacter infection or stress or maybe dietary factors itself. And it's also leading to so many complications like obstructions, hemorrhages, or perforations. So I'd like Dr. Singh to give us a view about the therapeutics of peptic ulcers. This is the second part of the peptic ulcer seminar. Welcome, sir.
The share part is not coming now.
Sir?
Am I visible?
Yes, sir, you're audible. You can press enter.
Good evening, everyone, and thank you very much for calling for this meeting. In the first part, last week we had discussed causative factors, the introductory part, complications, and other things about how to diagnose a case of peptic ulcer. Today we will try to discuss the homeopathic management, the normal management, and some important medicines for this. As a doctor, all of us know so many medicines for peptic ulcer. It's a very common problem, and the medicines are also very common. We have read several times. I will try to have a proper differentiation between some important medicines. There are n number of medicines which cannot be covered in this lecture. So I will try to give you some guidance in selecting the medicine, some guidance in selecting the miasms, and some guidance in comparison of some important medications. And if time permits, Dr. Dhanesh last time told me that you should present some cured cases of peptic ulcer also for this seminar. But I went through my all record. Maximum of records are showing the patient came with gastric ulcer, duodenal ulcer, was cured. But the thing is that very few patients are ready to go for endoscopy after when they are cured. When they are symptomless, they are asymptomatic. A maximum of patients don't want to go for the endoscopy for a clinical record for us just to take that this case was cured. But I have one case. If time permits, I will present that case to you. So let us start a roadmap for the treatment of peptic ulcer. These are a few methods in allopathic science nowadays, which are being followed very commonly. And as we know, these are number one, proton pump inhibitors, PPI, very common medicines. All of us know that the patients are being given in plenty, pantoprazole, omeprazole, and all these medicines are known as PPI, proton pump inhibitor. Their function is to reduce the acidity. Second is H. pylori eradication therapy. Nowadays, this therapy is being followed very commonly. The doctors are giving a combination of two antibiotics to the patient for a long time so that this completely eradicates the H. pylori infection. Third is antacids to neutralize stomach acid. As we know that acid is the medium which erodes the stomach and forms an area for the growth of the H. pylori. So these antacids also help. HT receptor blockers, they are also one method by which the acid secretion is reduced. PPI, proton pump inhibitors, and H. pylori. H2 receptors blockers. These two are the treatments by which the basic purpose is to reduce the acidity of the stomach. If the acidity is reduced, the patient will feel better. And dietary and lifestyle changes. Some important guideline to the patients for diet and lifestyle changes, which we will discuss later on again. Now, what is the miasmatic analysis? So while going for a miasmatic analysis, all of us know these things. That's a revision for your and my knowledge. So there is a soric stage. We know that there is a soric stage, there is a psychotic stage, and there is a syphilitic stage in case of a gastric or peptic ulcer. The soric stage is fundamentally functional disturbance, that is early ulcer stage. So there will be indigestion and heartburn. The pain will be better by eating. We discussed all these things last time. Because due to hyperacidity, there is severe pain. When the patient eats something, it goes into the stomach, neutralizes the acid, and the patient feels better. And there is no deep tissue damage. Mark this word. In the soric stage of this disease, there is no deep tissue damage. The ulcer is not very deep. There is mild erosions, hyperacidity, pain, which is normally better. All the symptoms of our gastric ulcer. Next is the psychotic stage, when there is a chronic infiltrative stage. This is a chronic stage. There is infiltration of the problem, thickened mucosa. The mucous membranes becomes thick. There is chronic inflammation, and there is ulceration with mucus secretion. Mucus secretion is a great keynote for a psychotic patient. So we know that this mucus secretion is very common in cases of, you will see there is argentum nitricum, there is arsenic album, there is mercurius, there is caliad. All these medicines have this kind of a thing, which is having destruction, and they are very common in case of psychotic stage. But sometimes puja also is helpful. Next is the syphilitic stage, when there is severe destruction and complicated stage. This stage is having deep ulcer and bleeding, perforation and stenosis, severe weight loss. The second is not easily curable with medicine. Mind my words, if you doubt that there is perforation, immediate hospitalize the patient. If there is pyloric stenosis, in the early stages, you can try with medication. In the chronic stage, when it is completely blocked, there are symptoms, and if it is confirmed by endoscopy, so don't take this case. Severe weight loss, because it's very common, very understanding that a patient is not able to eat. His pylorus is blocked. Okay, see, here is the blockage. This is the pyloric area. This is blocked. When the patient eats something, it comes in the stomach, remains there. The patient tries to digest, but it remains there because it cannot pass. So it cannot pass through the pylorus to the duodenum. There is sometimes pain, sometimes heaviness, and patient becomes very fearful. So he stops eating. He stops very small quantity. So the food remains here for 1 day, 2 days, 3 days, 4 days. When stomach is full of food, it is not passing down. So there is sometimes the body rejects the food, and there is very, very severe kind of a vomiting, which is severe projectile vomiting, which comes out after 2-3 days, and it contains undigested food particles. Which the patient ate 3 days back, it will contain that. If this part is there, it is a very serious condition. So there are 3 miasms, basic miasms. Next is miasmatic analysis. There is a simple rule, which if you can remember in case of peptic ulcer, it will be very easy for us to understand that what kind of miasm the patient is suffering from. This rule is known as FSDI rule. This rule is known as FSDI rule. So this FSDI rule, the F is disturbance in function. You can see this disturbance in function. This indicates soric condition. So there is burning and hunger. No severe damage to the mucous membranes of the mucosa. So gastric mucosa or duodenal mucosa, they are not severely disturbed. So this is known as the F part. Next is the S part. S is severe secretion. I told you in the last slide also, there is secretion of mucus sometimes thick, sometimes thin. If there is thick, stringy mucus, the medicine is calibichrome. If there is thin discharge, there is argentum natricum. If the mixed discharge, yellow in color, then the medicine is hydroxys. So the secretion part is known as psychotic taint. So there is psychosis, there is heaviness and secretion of mucus. Next is the D. Next is D. D comes for destruction. FSDI. So D comes for destruction, which indicates syphilitic miasm. There is formation of deep ulcers and bleeding. So please remember these 4 words. FSDI. You will remember all miasms and you will be able to identify all miasms. The I is instability, which is a tubercular miasm, which is rare in case. But it is found sometimes, but it is rare in case. So tubercular miasm is when there is wasting and changeable nature. The wasting will be due to lack of proper eating. Remember FFT, function, problem in functions, problem in secretion, and problem leading to destruction. These 3 are the main causes of miasmatic changes in case of peptic ulcer. This is psora, psychosis, syphilis, and tuberculosis. All the 4 miasms are there. Psora is indicated by SAD, stress, anxiety, acid hypersecretion. Sometimes duodenal ulcer is more common in, because gastric ulcer, the damage is more. Psychosis is numb feeling, numb. N is for NSAID. I told you last class that NSAIDs are one of the most important factors of causation of ulcers, because NSAIDs are producing severe acidity. Urea breath test. This is a test which I told last time also, that there is a secretion of when the patient is being given to eat ammonia liquid, it goes inside the stomach, it breaks down, and then patient is asked to breathe heavily. When he breathes heavily, the discharge is collected, and if there is presence of urea, it indicates urea breath test is positive. It means there is H. pylori, because we know H. pylori breaks down the things to urease, and urease is broken down into ammonia and urea. So presence of these things in the breath. Melena, bleeding from the rectum, with stool. Melena is occult blood in the stool, which is more common in duodenal ulcer. It's burning pain. Like ulcer, syphilitic is known as ulcer. U is mostly upper abdominal pain, loss of appetite. C for coffee ground vomitus. This is the gastric ulcer. If there is vomiting with coffee ground, it is bleeding in the vomit. That is known as hematemesis, and it is the case of gastric ulcer. Epigastric tenderness, better by food. I told you that when patient eats a small quantity of food, the acid is neutralized and the patient feels better. Tubercular is not that common. Now there is a mixed miasms also in case of peptic ulcer. So there is combination of psora and psychosis. There is combination of psora and syphilis. There is combination of psychosis and syphilis. So it is in acute cases, these mixed miasms are not found. But if there is combination of psora and psychosis, there will be burning, heaviness, alternating symptoms, chronic ulcer with mucus and acid. So there are medicines which cover all these things. We will come to that. There are acidity, there is mucus, there are chronic ulcer. The most important medicine, Lyco, Nux, Caliban. Psora with syphilis is burning with rapid worsening. Erosion, as there is syphilitic miasm, there is erosion, bleeding tendency. Common medicines are arsenic, Nux, and acid mat. There is combination of psychosis with syphilis. This combination has marked debility, foul symptoms, serious condition, indurated, irregular, possibly malignant ulcer. Thuja, Carbovage. So these are the some guidelines. We are discussing only guidelines. We cannot discuss the complete medication in these cases, but this is a small roadmap of taking the case, understanding the case as per miasms. Now we will come to some most important medicines for peptic ulcer. The most important number one medicine is argentum nitricum. Always remember this as the first medicine for peptic ulcer. It covers the gastric ulcer, it covers the duodenal. Where mental symptoms are very prominent. All of us know. It is just a revision. I am not trying to teach you materia medica, but this is just a revision that there is loss of control, want of balance. This is the mental condition of the patient. Irritates mucous membranes, argentum nitricum. Inflammation, gastroenteritis. What happens when there is gastroenteritis, which we get argentum nitricum? Loose motions, loose stools, lack of confidence. Patients, when wants to go somewhere, wants to go to the washroom due to lack of confidence. There is great desire for sweets. This great desire for sweets is also present in lycopodium. In one case, it relieves. In one case, it does not. There is splinter-like pain. Pain increases and decreases gradually. Belching with most complaints. Belching is great keynote for argentum nitricum, whether there is ulcer or not. Patient will come to you, when I press my abdomen, there is a belching. When I press here, there is a belching. Severe belching accompanied with all the gastric problems, including ulceration. So that is an argentum nitricum case. Painful spot over stomach radiating to all parts of body. Remember this symptom. There is a painful spot in the abdomen, and from that spot, the pain is radiating to all parts of body. That is argentum nitricum. If the patient comes to you and tells, here I am having pain here, he is covering the spot of the pain by fingertip, then the medicine is calibichrome. Ulcerative pain, mostly left side, and flatulent distension. This flatulent distension, accumulation of gas, accumulation of flatulence, severe belching, heaviness in the abdomen, pain in the abdomen, so craving for sweet, patient very nervous, lack of control, all these combinedly make a case of argentum nitricum. The best quality of argentum nitricum is that this is antiscrofulous, antisyphilitic, antipsychotic, antisocial. Dried up person, tired person, tired of his disease, when they are go to somewhere, then feel like diarrhea symptom, radiating pains. This is your argentum nitricum. Next, most important, very important medicines is arsenic alum. Don't forget this medicine in cases of peptic ulcer, and it's very peculiar, very different from argentum nitricum, but very important. So the most important part of arsenic is the mental picture. You know, all of us know that arsenic patient is very restless, very fearful. He is having fear of death. He is very lean and thin, but very particular about the cleaning part of the system, of the room. He is very particular, very weak, but very sharp, but having very, very extreme fear. And in chronic cases, the patient is regularly having fear of death. This fear of death is due to depression, because his suffering is very long. He is not being cured by this problem. So he has started fear of death. He feels that he is going to die. Patient feels that he will die. There is no use of taking the treatment. Just reverse to this is aconite. Aconite is also having severe fear of death. But aconite will ask for the doctor. Aconite will tell you, please call the doctor. If you don't call the doctor, I will die. That is aconite. Arsenic is great fear of death, and he tells, no, there is no use of calling the doctor, I am going to die. That is the mental condition of an arsenic patient. And the physical symptoms are that there is severe burning pain. So there is intense burning stomach pain. You can see intense burning stomach pain, which are aggravated by eating. There is tenderness, debility, sinking feeling. Next is vomiting of food. As we discussed, vomiting rejects everything. vomits, which ameliorates. If this symptom is there, you can guess that this is a case of gastric ulcer. Because duodenal ulcer is not having vomiting very easily. Gastric ulcer is having vomiting very easily. And very important part, thirst. Arsenic patient is very thirsty. But the peculiarity and the quality of arsenic thirst is that he wants that he should drink water, small quantities, frequent intervals. There is unsatiable thirst. He is not satisfied. He takes 2 sips, then again, after a few minutes, he wants more. So there is severe thirst, but this thirst is not satisfied with 250 teaspoons of water. But he cannot take more water because he is fearing that he will vomit. The same thirst part is present in bryonia also. But in bryonia, the thirst is satisfied. Arsenic, the thirst is not satisfied. In arsenic, the quantity is very small, wants frequent sips. Bryonia he takes large quantity of water at long intervals, and his thirst is satisfied. Aconite is having severe thirst, which is never satisfying. He takes large quantities, but is not satisfied. So these are basic differences between the thirst. And there is severe cutting pain. Pain radiates from epigastric to spine, a stooping posture, and aggravated by altitude. So these are some peculiarities of arsenic album, and due to not eating properly, he is getting emaciation. There is complete emaciation because he is not able to eat. He is going thinner and thinner. There is rapid weight loss, the pale, cachectic, poor digestion. The third and the most important medicine is calibicol. Just remember these 3 medicines. These 3 are the best medicines for curing a case of peptic ulcer. So there is calibicol, which we can see. The most important, it acts on mucous membrane of the stomach and intestine. There are round ulcers of stomach, cannot digest meat. There is desire for beer and acid. But the most important symptom is this. There is cutting pain in abdomen, and the pain in small spot can be covered by tip of finger. This is very important. The patient will pinpoint that I am having pain here, I am pain here. So this is a calibicol patient. Wave-like contraction with pain beginning from navel, and there are chances of perforation. As it deeply engraves the mucous membranes of the stomach, in chronic cases, you will get distress. Little comparison we have already discussed, but let us see. So some comparison between these 3 most important medicines: argentum nitricum, arsenic album, and calibicol. The argentum nitricum mental picture is, we have discussed, anticipatory, there is anxiety, hurry, impulsiveness, there is phobia, fear. Arsenic album is profound anxiety, fear of death, illness, restlessness, fastidious, fears being alone. And calibicol, mental pictures are not these prominent like these 2 medicines. He is irritable, determined in routine, ill-humored, very angry. Gastric and digestive profiles. This is important. And in argentum nitricum, there is great distension of the abdomen. There is enormous belching, desire for sugar, splinter-like pain. We have discussed. There is intense burning pain in arsenic album, severe nausea and vomiting. Intense burning pain, severe nausea and vomiting, offensive diarrhea, extreme weakness. In calibicol, there is heaviness, round punched out ulcer, vomiting of ropey mucus. This, remember, calibicol is having discharge of ropey mucus. The mucus becomes like a rope, like a string. It will be sticking and it will just hang down from the mouth. In this case, the medicine is calibicol. If there is more secretion of mucus, but it is not very stringy, then the medicine is hydrestys can. These are small things. If you can remember these things, you will be very successful in the practice or curing a case of peptic ulcer. Next is the type of pain is splinter-like sharp pains in the throat, stomach, and skin. This is argentum nitricum. The arsenic, there is intense burning pains, which is better by heat. It is not better by cold water. There is pain, the type of pain is burning, but he will be feeling better by warm water. Cold water is not tolerated. It gets vomited. And in calibichrome, the most important part, localized in small precise spots. All symptoms are having in calibichrome. This pain is associated with all symptoms. And mucous membrane discharge, which we are discussing, there in argentum nitricum, there is a mucous discharge, mucopurulent discharge, thick mucus in the throat, where it is not like calibi, which is thick, tenacious and stingy, ropey. And in arsenic album, the discharges are acrid, corrosive, burning. Arsenic is poison, no? Arsenic by nature is a poison, so its effect on the gastric mucosa are very severe. So this is in small, the basic comparison of these three medicines in case of peptic ulcer. Next, a very important medicine is the king of ulceration medicine, that is hydrostatic scanning. It is so important. One of my senior teachers, he always told me whenever we met him individually, he was telling, beta, you see, hydrostasis name is golden sea. So always remember, this is the golden medicine. It can cure, it can help you in all cases. Severe ulceration, severe indigestion, severe cancer cases. Don't forget your golden sea. The name is golden. And the peculiar part is that the discharges are whitish yellowish in nature. So that gold is involved there. So the digestive system, it acts as a tonic to mucous membrane of the stomach and intestine, increases secretion of bile and gastric juice and improves sluggish digestion. In my practice, I am using hydrostatic scan in plenty in cases of gastritis, in cases of indigestion, in cases of flatulence, in case of gastric ulcer, chronic peptic ulcer, and more profusely in case of gastric carcinoma. This medicine is a magic. It helps in mother tincture form. Sometimes I give some medicine which are constitutional to the patient or more symptomatic to the patient. And when the patient feels better and better, but some parts are remaining to be cured, I always take help of hydrostatic, which has helped me almost in 70 to 80% of this. So don't forget this medicine. And this medicine is having, it acts on the digestive system. It is a tonic to stomach and intestine, increases bile and gastric secretions, and helps to remove the problem. It stimulates liver function, which promotes bile flow. The mucus is thick, yellow, ropey mucus discharge. And mind it, this is pre-cancerous stage. Don't forget that this is a medicine which is being used for pre-cancerous stage. When the duodenal ulcer is very serious or chronic, or when the gastric ulcer is very serious or chronic. So in case of that, please take this medicine as a palliative thing. Next is a very important medicine and often neglected medicine for a case of peptic ulcer. That medicine is ornithogallum. Ornithogallum is a great medicine which has always been helpful when the ulcer or the complications are concentrated to the pyloric part. You can see this is the pyloric part. This is the pyloric part. This is the stomach. This is the duodenum. This is the pyloric part. When the problems are concentrated into the pylorus part, then the best medicine is ornithogallum, whether it is gastric ulcer, whether it is duodenal ulcer, where it is carcinoma, and one more point, when there is chances of pyloric stenosis. I told this in the last class also, that in case of pyloric stenosis, one of the best medicines which we have is ornithogallum. Dr. Boric has written that the center of action of this medicine is pylori. Dr. Boric has the center of action is pylori. It causes painful contractions in the pyloric region. So the center of action is pylorus. The pain is increased when food passes pyloric outlet. Obviously, mechanically we know that when there is obstruction, with this part is obstructed, whenever the patient will eat something, when it will pass from this area, there will be serious pain. Vomiting of coffee ground matter. This is blocked. When this is blocked, the contents of this part will be vomited after 1 day, after 2 days, after a few hours. And depending on the duration of the vomit, the color of the vomit will be either coffee ground or without color, or some mucus will be there. So there is agonizing feeling in chest and stomach arising from pylorus plate. So remember this medicine when the area of concentration is pylorus. Dr. Boric has given the dose that he has written in Boric's Mathematica, single dose of mother tincture and await action. Dr. Boric has written in this Mathematica that give a single dose and just wait for the action. So sometimes we become restless also, including me. So whenever there is pyloric stenosis, we take help of this problem, ornithogallum, but I give 1 dose daily. In spite of giving 1 dose and waiting for a very long time, I give 1 dose daily for 20 days, 25 days, 30 days, and very often ornithogallum has helped me, especially when the pyloric stenosis has not aggravated. It is not serious, but mild stenosis can be cured with ornithogallum. Please remember this medicine always in your mind, that this is one of the best medicines to help you in cases of peptic ulcer, but especially when there are the pylorises involved. And one very important but less used medicine in case of this is symphytum. We are using symphytum for mostly fractures of bone or bony problems, disturbances in bone. There is dissection of bone, there is other problems of bone, but we are not using in case of this. But the symphytum, the plant, the comfrey, it has a tendency, it has a quality, it has a soothing effect and healing effect for the mucous membrane. So in very complicated cases, sometimes when the symptoms are not very clear, symphytum mother tincture has been very helpful in taking care of a case of peptic ulcer. So there is ulcer of stomach, you can see. Ulcer of stomach and duodenum, gastric ulcer and duodenal ulcer both. It has a soothing effect, it calms inflammation, it protects, it makes a protective mucus layer above the ulcer so that the food and the acid will not harm, not affect the ulcer, and there is relief from the pain by formation of this mucus layer. And the elimination of crystalline solid from root. This root is very crystalline and solid, but very helpful in it stimulates epithelium growth on ulcerated surface. This is the most important quality of symphytum. It stimulates epithelial growth on ulcerated surface. This is the ulcerated surface, and the epithelium grows up and the ulcer is formed. So don't forget this medicine, the symphytum. So I have just discussed 5-6 medicines. There are n number of medicines. You take Boric, you take any good Mathematica, go to the stomach and duodenum part of the medicine. Almost all medicines are having some or other problem with the gastric mucosa. But you will have to be very specific when going for this kind of seminar, or when understanding that how you will be able to cure or help a patient of gastric or peptic ulcer. So these are the few important medicines. Now I will try to discuss that which are the important medicines according to the area of the ulceration. You will go to the boric, and boric has very specified that this medicine acts on this area, this medicine acts on this area. So we must understand that which are the medicines which will be very helpful to us area-wise. Let us see medicine as per location. This is the stomach, and these are the different parts. No need to explain. Esophagus, thoracic sphincter, fundus, cardiac, body, antrum, pylorus, and duodenum. So let us try to understand that which are the medicines, important medicines for peptic ulcer, and which are the parts where it acts. Just see. This is Kondurango. As we have discussed, that Kondurango is having special affinity for the pyloric part. So Kondurango is helping, working, creating symptoms, creating ulceration in the pylorus part and occasionally in the esophagus. But the main action of Kondurango is in the pyloric part. Next medicine is, you can see blue stars, that is Calibycom. So Calibycom is a very common, it produces all kind of ulcerations. So you can see there is ulceration in the first part of the stomach. There is ulceration of the lesser curvature of the stomach. There is sometimes ulceration at the greater curvature of the stomach. So it works almost in all parts. This is the fundus. This is the lesser curvature. All these blue stars resemble Calibycom. This is the pylorus. So Caliby is a medicine which can produce ulceration almost in all parts. Kondurango was the medicine which was working in only pyloric part. But this is Caliby. That is why Caliby is most frequently used to cure a case of peptic ulcer. Let us see what is the next medicine. The next medicine is uranium nitricum. Very important medicine for peptic ulcer, and especially when the patient sometimes is diabetic. In this case, uranium nitricum works like magic. This is the uranium nitricum, and most important part is the pyloric antrum. It produces ulceration of the pylorus. If you know the site of the stomach, site of the ulceration, by this guideline, it really concentrates, it takes you to a group of medicines from where you can select a proper medication as per the symptoms in them. But as per the site of the stomach or duodenum, these are a few medicines which will help you immediately diagnose your case. The most common medicine which helps in all kind of ulceration, that is argentum nitricum. You can see argentum nitricum is in the stomach, lesser curvature. It is in the pylorus, duodenal, first part of the duodenum. This is in the greater curvature of the stomach. This is the greater curvature of the stomach. So it works, it creates ulceration almost on all parts of the digestive tract, which is the stomach and the duodenum. Please don't forget these things, which will be very helpful in your practice life. Last medicine, as I told you, is hydroxyl. As I told you, hydroxyl is a very good medicine, and you can see pink spots. It is in the last part of the stomach, first part of the duodenum. So these are the two parts where it really acts nicely. This is the last part of the stomach, pylorus, and this is the first part of the duodenum. So duodenal ulcer, gastric ulcer. These are the two main areas where the hydroxyl ulcer is found. I hope this makes very clear to you now that as per the location of the ulceration, what are the medicines which will help you. Now, very common thing, because every patient comes with the pain. How will we differentiate the pain? These are types of pain which will help you. If the pain is covered by a fingertip, there is Calibycom. If the pain is radiated to left lower rib, this is the pain radiation to left lower rib, the medicine is arsenic alpha. If the patient, the pain is spreading all over, it starts here and it spreads all over here, then the medicine is argentum. Pain spreading in all directions. Pain is in the pyloric region. Pain is in the pyloric region. The best medicine is ornithopathy. Pain radiating upwards. There is severe pain and it goes up. When it goes up, then the medicine is naxolita. If the pain is there, it goes back and travels to right side, then the medicine is lycopodium. So by the location and the direction of the pain, we can very well understand that these are a few medicines which will help. Next is by the endoscopic view. The patient go for endoscopy. So which will be the medicine? This is the diagrammatic representation of the esophageal ulcer. So if the esophageal ulcer, violent sticking ulceration is there, violent sticking pains are there. You can see violent sticking pains in the throat, esophagus, like a sphincter. This kind of a violence is there in the medicine is nitric. Second medicine, esophagus ulcer is calicarb. Sorry, please correct it. This is calibichrome. It's a typing mistake. This is calibichrome, and the key symptom, sensation of a lump or food stuck in the esophagus. There's difficult swallowing. And next is carbo-vegetabilis. When the esophageal ulcer is there, the symptoms are severe flatulence, bloating in the upper abdomen, severe belching. So these will be helpful. Esophageal ulcer is not very common. The most common symptom is gastric ulcer. So in case of calibichrome, this kind of a look will be there in the endoscopy. Round punched out ulcer. Just remember, which I am repeating and repeating. Calibichrome will always have a punched out ulcer with severe discharge, sticky, stingy discharge, and pinpointed pain in the epigastrium. Remember these four things. Round punched out ulcers, clean margins, yellowish base, thick tenacious mucus coating. Thick tenacious mucus coating. This kind of endoscopic view will also help you in diagnosing case of gastric ulcer and medicine. Arsenic album is there. So this yellowness is not there, but ulceration is deep ulcer with irregular edge. The irregular edge ulcer is there. Necrotic patches, tendency to sloughing. The sloughs are made, and arsenic mental picture is very deep. The patient is restless, the patient is fearful, the patient is having vomiting, the patient is having aggravation by warmth, cold drinks. Next is very important but rarely used is mercuriation. Mercurius group. This mercurius group also is having this kind of ulceration, deep eroded ulcer, uneven ragged margins, dirty gray, marked corrosive destruction. Mercsol is itself a syphilitic medicine. So mercurius group is having this kind of a problem. Next is the most important, duodenal ulcer. You can see this duodenal ulcer, lycopodium, irregular jagged margins, dirty yellowish base, congested mucus, patchy erosions, congestion. Symptom क्या है? Marked abdominal bloating and flatulence, typically work from 4 to 8. This is the lycopodium symptom all of us know. There's early satiety, feeling full after only a few bites of food. The patient will say that if I eat something, my abdomen is full. It is bloated. I cannot eat much. That kind of a symptom will be present in case of lycopodium. Anacardium oriental, it is always better by eating. Remember this. In case of peptic ulcer, if the patient always tells you that he is better by duodenal pain that is temporarily relieved by sensation of a plug in the stomach, and this kind of endoscopic view will be there. There's a clean margins. So this kind of patient, anacardium mind, very forgetful, anacardium mind, very nervous, and he is always better by eating. Always carries something in the pocket and eats a few biscuits every off and on. Phosphorus is not a very common medicine, but it is very useful if when it is indicated. So phosphorus symptoms are there is burning pain in the stomach, often relieved by cold, and frequent warmth. This is about duodenal ulcer. Now we can have some medicines as per the types of vomiting. If the vomiting is with severe mucus, the medicine is tabacum. If there is medicine of water, vomiting of water or drink just after taking it, then commonly the Daxvomica. With glary mucus, with argentum natrum, which we have discussed. With green bile, water, mucus immediately after eating is arsenic album. And bismuth is a medicine which will help you, especially when there is problem in the pylorus. So pyloric stenosis, ulceration in the pylorus, duodenal opening is very narrow. Duodenum is a very narrow tube. Stomach is a very big organ. Stomach walls are very thick. Duodenal wall are very narrow. So if there is some problem in the duodenum, it immediately constricts. There is constriction. This is duodenal tube, and there is a problem, it constricts. It moves down, it moves like this, and there is blockage of the pylorus. If that is starting, then as soon as the patient eats something, it is vomited out. Immediately after eating, in that case, for relief, the best medicine is bismuth. Don't forget bismuth. Vomits as soon as water reaches the stomach. There are some more medicines which we will know, which we can know, that there is geranium maculatum. Geranium maculatum mother tincture is one of the best medicine when there is bleeding from the earth. When the patient is complaining that on a daily basis, on a day-to-day basis, I am having vomiting of blood. That is hematemesis, sometimes fresh blood, sometimes mixed with food. In that case, you can take help of geranium maculatum mother tincture. And next medicine is atropine sulfuricum. What is atropine? Atropine sulfuricum. Atropine sulf is the alkaloid of belladonna. It is an alkaloid of belladonna, and this is being helped when there is severe gastric pain and spasmodic abdominal pain, useful in hyperactivity with intense burning in stomach, relieves the spasm of gastric muscles and colicky pain. It's not very commonly used, but it is in the Borix Medica that this is a medicine which can help you. Iodine natricum is a very important medicine, and this iodine natricum, the peculiarity of a case of uranium natricum is that it is having ravenous appetite. This ravenous appetite is not present in all cases. The patient is feeling better after eating anacardium. The patient feels better in case of gastric ulcer because it relieves the acidity in the stomach. But ravenous appetite, the eating like bad, he likes to eat like bad, that patient is of uranium natricum. And there is mucus discharge, there is burning pain, there is vomiting, there is intensive thirst, and often associated with excessive acidity. Excessive acidity with ravenous appetite sometimes is helped by uranium natricum. Next medicine is Robinia. Robinia is sometimes given in mother tincture form, and its simple local action is it relieves acidity. That is only thing. We have been using in gastritis cases. There are two medicines which are almost specific to relieve the acidity. Two medicines. One is Robinia mother tincture and one is iris wurz. Don't forget iris wurz. One of the best medicines, these two are the medicines which will symptomatically relieve the acidity at least. If the patient is having severe gastritis, severe acidity, not being helped by other medicines, take help of these two medicines. Robinia and iris wurz. And third medicine is there when specifically there is severe acidity. No other symptoms are there. Only acidity, acidity, acidity. The best medicine is sulfuric acid. These are a few tips which you can take. Sulfuric acid is helpful in acidity, and if there is severe burning pains in acidity, severe burning. So this severe burning is being helped always by capsicum. Capsicum, acid sulf, iris worms, robinia. These are a few medicines which will always help you in case of curing a case of ulceration. There is Nux vomica. I don't want to describe Nux vomica for more, but nowadays sedentary habit, modern days life, alcoholism, irregular diet, tension in work, all these are the causative factors for Nux vomica, which may lead to formation of gastric ulcer. There is lycopodium, which I have already discussed, anacardium, which we have discussed, bismuth we have discussed. So there are these other medicines. There are more medicines. I am concentrating only on a few medicines which will help you in manage a case of peptic ulcer. Next, I told you that I got only one case which I had the endoscopic view of the patient. So this patient was 52 years old. These were the symptoms: pain epigastrium aggravated by eating, vomiting after eating, great fearfulness, fear of death, great emaciation and loss of weight, severe thirst, feeling better by heat and warm drink, severe restlessness. Patient was taking allopathic medicine with partial relief. Endoscopy showed gastric ulcer, severe with erosion. So I didn't have to work hard because you see the symptoms are a grammatical picture of arsenic ulcer. Isn't it? Pain in epigastrium, vomiting after eating, great fearfulness, fear of death, great emaciation, thirst is more, better by warm drink, feeling better by warm drink, there was great listlessness. So without thinking anything, as the picture was so clear, the patient was prescribed arsenic album 30 and was prescribed 3 times daily with proper diet, restrictions and guidance to report after 15 days. So after 15 days, this patient came to me. Arsenic 30 was repeated. He was feeling little better. Pain reduced, vomiting reduced. So arsenic was repeated. This was the endoscopy in 5th of March 2007. In the meanwhile, he gained 1 kg of weight. Arsenic 30 was repeated. No change in medicine. When on 5th March the patient came, there was improvement. The ulcer was being healed properly. Endoscopy report states that the condition is little better. Arsenic album 200 once daily was given, and I was told, as my experience goes, that I prescribed hydrostis mother tincture, 10 drops 2 times in addition to this one. Arsenic 1 dose daily 200, hydrostis mother tincture, 10 drops twice daily. Next visit, August 2007, no arsenic, only hydrostis, and on 20th/10/17, almost about 1 year, this ulcer was healed properly. This endoscopy report says, the endoscopy says ulcer healed. Placebo prescribed for 3 months, diet restriction will continue. I could get only one case which helped me in this case to cure a case of by arsenic. And I am very sure that arsenic helped because the symptoms were very, very similar to arsenic. So constitutionally, the symptoms matched arsenic. Arsenic helped a bit. In addition, as for my practice experience both, I took help of hydrostis mother tincture. And this case was completely cured. Do you have time? I will tell you some other medicines which can help you in short. That is chamomilla. Chamomilla tea. Chamomilla tea is very helpful. It inhibits growth of H. pylori. It soothes mucosa. It soothes irritability. It helps in nausea and vomiting. Chamomilla mother tincture or chamomilla tea is very helpful in old times. Since old times, it is being used. There is licorice, very good medicine. Like is the glabra, this is the medicine which every household is having. This is a medicine, Ramban for gastric ulcer. You can give this mother tincture is available, Cacteria glabra, gastric and peptic ulcer, lower stomach acid levels. It coats the ulcer, relieves the pain. So this is a plant which will help you. Marshmallow, this also is a very good medicine. These three are the medicines which are not properly used in homeopathy, but the mother tincture is available. So if you want some help, you can take help of these, and king of all medicines is aloe vera. You can use mother tincture of aloe vera, and sometimes at home, these four things are there which will help you. Neem, tulsi, turmeric, eagle marrow, bael. This is bael. All these are household things which will help you in treatment of peptic ulcer. And some do's and don'ts for this, that eat small frequent meals, eat slowly and chew well, include high fiber food, stay hydrated, take probiotics. And don'ts is avoid spicy and acidic food, avoid caffeine, alcohol, don't overeat or eat late at night, avoid smoking and limit and save. Unless and until you change the lifestyle of a patient, you will not be able to help a case of gastric or abdominal. The lifestyle change is very, very important if you want to help your patient with proper medication. So this, I would like to end my lecture in this. If you have any question, thank you very much. If you have any questions, please. You are welcome.
Oh,
Hello,
Doctor, you're audible, please.
hello.
Doctor, you're
Can you-
audible.
Okay. Doctor KULWANT Singh,
Yes, sir.
you are very familiar to me. Your class is very nice and wonderful. I am
Yes.
appreciating you. But one of my doubt is that I have a patient, see, with peptic ulcer and hiatus hernia.
Yes, please.
Can you give me any suggestion for that? Now patient is getting relief by lycopodium. Any other?
These two are completely different propositions, different diseases. Hiatus hernia is having a different pathological cause. And in case of hiatus hernia, there are two main medicines depending on the causative factor of the case. One is Lux vomica and one is Rustux. Don't forget these two medicines.
Okay, thank you, sir. Thank you, sir.
Welcome, sir.
Yes, since the time is up and we have to wind up now, I thank Dr. Singh for spending time with us and also for this wonderful session of about peptic ulcers. And I'd also like to thank all the participants of this webinar. And everyone, please note that in case you have missed any sessions, we always have the recorded versions in our YouTube channel of IFPH Talks. And that's all for today. Thank you, everyone.